Hello, everybody. How's everybody doing today? It is Sunday, September 17th, 2017, and this is Dr. Nicole. It is 3 o'clock p.m. Eastern Standard Time. It's 12 noon Western, Western Standard Time. No, Pacific Standard Time, excuse me. Pacific Standard Time. And today I'm here on the West Coast, actually, so it's 12 noon where I'm at right now. But I still wanted to come on so I could have a talk with the doc session today. I actually had a friend of mine who requested that I discuss kidney disease. She says that she and a lot of other people that she knows are dealing with kidney disease, and that a lot of people don't know about the kidneys, what they are, what they do, and could I shed some light on the subject. So I said, sure. That's what Dr. Nicole is here for, right? I am here to explain medical conditions to people in terms that they can understand, right? Because when we know better, we do better. So I want you to go and invite your friends. I'm going to wait just a few moments before we get started. It's 12:04 right now. I'm going to wait 1 minute so that you can invite your friends and tell them to come on in to the room so that they can learn all about the kidneys, all right? So, like I said, I am on the West Coast today. You know, I usually live on the East Coast, but today I'm on the West Coast. I'm in Vegas, y'all. Yes, I'm having fun in Vegas, celebrating my sister's birthday, and we are having a great time. So, coming on a little earlier today, in terms of 12 noon Pacific time, but it's still 3 p.m. Eastern Standard Time. So I wanted to take a moment out of my vacation and just share with you all some topics about, some tips about kidney function, what they do, and how you can make them better, all right? I'm gonna wait one more moment. Please share this video so that some other people can learn about the kidneys and what they can do to make them healthy. All right, when you come in the room, also please leave a comment, share your name so that I know that you're here so that we can talk. Bring your comments, bring your questions, and a little bit later, I'm gonna tell you how you can get in touch with me if you have some other questions. Hey there, Superior. Happy anniversary to you. It is my anniversary today, and I'm so happy to be married to my wonderful husband. I call him my sexy husband, Mr. Superior Edwards. So happy anniversary, baby. Thank you for joining in to the broadcast today. All right, everyone, please come on in. Please share this video, and we will get some more information about the kidneys. All right. All right, it's 12:05, so I'm going to go ahead and get started. You all know who I am. I'm Dr. Nicole, your board-certified family medicine physician. I'm also a trained professional marriage and family therapist, and I help pastors and everyday people live their best lives by transforming their mind, body, and spirit. By transforming their mind, body, and spirit so that they can have greater impact on those around them. Through my books, my concierge medical practice, my seminars, and my direct primary care concierge practice, I help people live their best lives and understand their medical conditions in terms that they can understand. Please follow me on Facebook. That's www.facebook.com/Dr. Nicole D.O. DRNICOLEDO. All right, well, let's get started talking about the kidneys, all right? So, what is a kidney? You've seen kidney beans, right? Kidney beans are the little half-moon-shaped beans, but they are called kidney beans because they are shaped just like a kidney. So, I'm going to show you a picture here. This is a kidney, all right? This is a kidney, what a kidney looks like on the inside. So, I'm going to break it down for you. On this kidney, you've got the red is the artery that's coming into the kidney, okay? The blue is the artery that's leaving out of the kidney, and the white little tube that's leaving out is the, that goes to the bladder, all right? So that's how your kidney gets everything to the bladder. So what happens is blood comes into the kidney through the artery, that's that red thing, and it goes through these little areas here. Those are called calyces. In those calyces are something called nephrons. Nephrons are the cells of the kidneys, all right? The job of the nephron is to filter that blood that came in through that red artery, all right? So the blood comes in. Hey, Dr. Crystal, thanks for joining in. The blood comes in. The ring is on, babe. I promise you the ring is on. The blood comes in through the artery. and then it filters in through the calyces, so all of the blood is filtered, and then the blood goes back out through the vein, all right? And that's how it goes back to the rest of the body. Now it's filtered, it's clean, you don't have to worry about any problems with it, all right? Now, that stuff that came out through the filtration goes into this white yellowish tube here, and that goes to the bladder so that you can urinate the filtered stuff out. So think of your kidneys as what I'm calling like a sieve. A sieve is like a filter, or like a colander. Think of it like a colander. So you know how, like, when you make spaghetti and or pasta, and you pour the noodles in, and so that the water can come out. So think of your kidneys like that. The stuff comes in, the stuff that is filtered out, and then what you want to keep goes back out through the vein, all right? That stuff that's filtered out goes into the bladder, and then you're urinating it out. So what is the function of the kidney? The kidney's function is to filter waste, all right? And it filters that waste in the form of urine, all right? So the urine comes out, and that's how we get rid of the waste that the kidneys collected for us, that the kidneys filtered for us. All right, so that's what the kidney is. It's like, as I said, it's like a filtration system, and that's how it works. So what happens when the kidneys don't work anymore? So the kidneys, there's a list of things that can happen when the kidneys are not working. You can have, if the kidneys are not filtering the way they're supposed to filter, you can get reduced urine output. So, like I said, remember the fluid goes in, and then the blood goes in, and then the fluid's supposed to come out. So if your kidneys are not filtering the way it's supposed to, you won't be making as much urine as you're supposed to. So then you can have, you're not urinating like you're supposed to. When you're not urinating, that means all of that waste and that toxic stuff is just building up in your body, in your bloodstream, because it's not coming out now, okay? So you can have reduced urine output. Your kidney also helps to make, there is something called erythropoietin, okay? Erythropoietin, they call it EPO for short. EPO is the hormone that tells the body to make red blood cells. So your kidneys are responsible for making the red blood cells. So if you don't have enough EPO, if your kidneys aren't functioning correctly and you don't have enough red blood cells, then you become what we call anemic. So I know you know what happens when you're anemic. When you're anemic, you can get cold, you can feel chills, you can feel tired, you can feel weak, you can feel dizzy, because what that red blood cell does is it carries oxygen to the rest of the body. So if you don't have oxygen, we talked about this before, lack of oxygen means cell death, right? So if you have cell death, that means that you are you can feel fatigued, you can feel tired, and that's a sign of anemia, all right? Also, like I said, you can feel cold, you can have chills. People eat ice because their bodies are craving the iron from the lack of the iron in the blood cells, all right? So the erythropoietin is very, very necessary. Yes, that's why you're always freezing, Trinae. It's because if your kidneys are not producing the way they're supposed to, then you have a lack of erythropoietin. So your doctors can monitor your iron levels and your CBC. Your CBC shows your blood counts, your hemoglobin, your hematocrit, and your iron levels. And if you have low iron, then they can give you iron. Some people with chronic kidney disease also get something called EPO, which is a whole infusion of that hormone to help the body produce more red blood cells, all right? So if you have kidney disease, you can feel tired, you can feel cold, and then what else can you have? You can have nausea and just feeling sick. Why? Because that's something, when the kidneys are not filtering properly, all of that waste that the kidneys are usually pulling out, all of that waste backs up and continues to stay in the bloodstream. We call that uremia. Uremia, U-R-E-M-I-A, okay? And so when you are uremic, or when you have that uremic acid in the blood, then you feel sick. You feel sick to your stomach. You get nauseated. You just feel general, what we call malaise. You just feel yucky all the time. You feel like you're dragging. You feel like you just can't, get started good, because you got waste all in your blood that's supposed to be urinated out, all right? So you can also get poor appetite, because when you become uremic and all that waste builds up, you don't want to eat because all of that waste is building up. No, I'm at the pool, but no one's naked here. So all of that waste builds up in the bloodstream, and so it can make you have poor appetite. All right. When that waste builds up, you can also get itching because that waste is then kind of implanting in the skin, and so you itch and you scratch and you scratch, and it's the scratch that doesn't get any better. So you could scratch for days and it's not going to feel any better because essentially that is that uremia in your skin. All right. It's under the skin, so you can scratch and it's not going to matter. All right. You can also get, if you have kidney disease, swelling, because your kidneys are filtering that fluid, and that fluid is supposed to be coming out, and then you're supposed to be urinating it out. If you're not urinating it out, that fluid builds up. When fluid builds up, where does it build up to? Well, it's going to build up to, it's going to basically go to any place that it can just kind of sit and pool. The places that we notice is in our feet, in our ankles, in our hands, in our faces. You get the puffy face when you're uremic or when you have kidney failure. And then you can also have it build up into your lungs. And of course, if it builds up into your lungs, then you can get short of breath and you can have trouble breathing. All right. So if you're noticing that you're having puffy ankles, puffy feet, puffy hands, you need to go see your doctor because they need to do some testing to make sure that you don't have increased levels of BUN, which is the blood urea nitrogen. That's that uremia, the uremia that we were talking about. You can test that in the blood to make sure that that's not elevated. You want to test the creatinine. They can test some other things to make sure that it's not backed up. All right. So like I said, you can also get shortness of breath because as the fluid is building up into the lungs, you can't breathe as much as you could before. All right, so let me just go through that list one more time. So what are the symptoms of kidney disease? Reduced urine output, fatigue, nausea, swelling in the hands, feet, face, tiredness, poor sleep, poor appetite, itching that's not explained. And it's like, I don't have any bug bites or anything. What if you're still using the bathroom regularly? Okay, so if you're still using the bathroom regularly, Trinae, what that means is that your kidney function, even though it might not be filtering the way it's supposed to, it's still as well as it could. You're still getting enough that you can still use the bathroom. All right. I've seen some people with there's varying levels of the kidney disease. So when it's very kind of early on, everything's still functioning the way it's supposed to, but we're seeing more numbers in the labs. All right. And so the thing about kidney disease is a lot of times it does not show up right away. And by the time it does show up, it's so far advanced that we're catching it and it's already become chronic kidney disease. So actually that brings me to my next topic. What's the difference between acute renal insufficiency and chronic renal insufficiency? So we know renal means kidney. Insufficiency means it's just not working the way it's supposed to. Thanks, Trinae. I'm glad this is helpful. I'm glad I can give this information. So acute renal insufficiency is when all of a sudden the blood is just not working, the kidneys are not working the way they're supposed to acutely, means you've had some sort of acute onset or some kind of injury. So there's three causes of acute renal insufficiency. One would be not enough blood to the kidneys. So we see that sometimes, like if you are dehydrated and you're not getting enough blood to your kidneys, let's say that we were to take your labs after that, we would see an increase in your creatinine, an increase in your BUN, and then we would say, okay, that's acute renal insufficiency. It happened all of a sudden because you weren't getting enough fluid in. We can fix that sometimes by giving you fluids, by drinking lots of fluid, sometimes we have to give an IV fluid. For instance, if somebody comes into the hospital and they're not feeling well, the first thing we do a lot of times after we check your labs is give you fluids. Why? Because those fluids can help the kidneys to kind of clear out and flush out, and then you can get that uremia to go away, and then you can feel better. All right? So number one cause of acute renal insufficiency is not enough blood to the kidneys. That's why I always encourage people, drink your water, drink your water, drink your water, because you want to keep your kidneys working. All right? The next one would be kidney damage. If there is damage to the actual kidney itself, then of course you can have renal insufficiency. If it happens quickly, then that would be acute renal insufficiency. So what kind of things can cause damage to the kidneys? Infections. So let's say you had a bladder infection that you didn't get treated, and that infection, that bacteria can go up the ureters, from the bladder up the ureters, and go into the kidneys. Remember when I showed you that picture of the kidneys? So it can go up the ureter here, and it can come into the kidneys. And when it gets into the kidneys, that infection can sit in the kidneys, and we call that pyelonephritis, which basically means pyelo is infection or pus, and then nephritis, nephron means kidney, so that means pus in the kidney. So when you have pus in the kidney, that can cause some kidney damage, and when you have kidney damage, then that can cause some acute renal insufficiency. The other things that can damage the kidneys are elevated blood pressures, because when you have elevated blood pressures, the heart is pumping harder, the veins are getting smaller, the arteries are getting smaller, and when the arteries get smaller, then the heart has to pump harder, and then that can cause damage to the kidneys, all right? Because now you're still having to push that blood through the arteries, but that increased pressure can cause pressure on the kidneys, all right? So that can damage the kidneys. The other thing that can cause damage to the kidneys is toxins. So, and when I say toxins, I mean even elevated blood sugar. So when you have diabetes that's uncontrolled, like I said, remember your kidney is like a filter. So let's say that the blood is coming through and it's full of sugar, because our blood carries sugar when we're diabetic. When that sugar comes through the kidney, those sugar molecules are very large. So when those kind of come through the kidneys, they can almost kind of rip through the filter or rip through the sieve, and so it can cause basically holes in your nephrons. Okay, so that can cause decreased filtration, because these big old huge sugar molecules are kind of like punching through the colander, the sieve, and so when that happens, you're damaging your kidneys. All right, so damage to the kidneys can be caused by blood pressure, diabetes, or infection. The last thing that can cause acute renal insufficiency is if you have blockage of urine from the bladder. So if you have kidney stones, or a stone in the bladder, if you have infection in the bladder, if you have some reason why your bladder can't get the urine out, then all of that urine is basically backing up into the kidneys, and when that urine backs up into the kidneys, it damages the kidneys. The calyces, or those little areas in the kidneys, those triangle-shaped areas in the kidneys, and so that causes damage. So when that happens, you can have acute renal insufficiency. So now what's the difference between acute renal insufficiency and chronic renal insufficiency? Well, when it's chronic, that means it's been happening for some time. So if you've had diabetes, if you've had high blood pressure, if you don't like to drink your water, if all of that is happening, you can get, over time, chronic renal insufficiency. And like I said, with chronic renal insufficiency, you can, you don't know that it's happening a lot of times until your doctors catch it. All right, and we catch it when we're doing our labs. That's why I encourage you to go to your doctor regularly, even if you feel fine, even if you think everything's good, for your annual checkups. Because at your annual checkups, we can grab a simple blood test. We call it a basic metabolic panel. In that metabolic panel, we're checking your kidney function. We're checking your electrolytes, your kidney function, your creatinine, your basic, the blood urea nitrogen level. So we're checking that BUN and the creatinine. If we catch that early, that there's some damage, then we can try and treat that early, all right? And the earlier we treat, the worse damage we can prevent. So just for your own information, a normal creatinine is anywhere between 0.5 and, depending on the lab, either 1.1, 1.2. Most people, though, if you're young and you're healthy and no other medical issues, I want to see your creatinine at a 1.0 or less, okay? If I start to see it traveling up, we're going to discuss, okay, are you not drinking your water? Let's check your sugars, make sure that your kidneys are not being damaged. Let's check your blood pressure and make sure that that's not being damaged, all right? Another thing that can cause damage to the kidneys is certain medications that we take, certain things that we ingest. So we know that NSAIDs, or anti-inflammatories that are like Motrin, ibuprofen, Aleve, those can cause increased damage to the kidneys. So if you're already dealing with some kidney issues, we tell you to avoid those products. Instead, use, let's say you have a ache or a pain, use something topical that's not going to filter through the kidneys as much. Use something that goes through the liver instead, like a Tylenol product, acetaminophen. Yes, Trinae, metformin, even though we give that for diabetes, that is filtered through the kidneys. So if you have an elevated creatinine of, ladies, 2.0 or higher, we have to take you off of metformin, because metformin is filtered through the kidneys. So anything that's filtered through the kidneys can cause more damage. I know, right? We give you one thing to treat one thing, and sometimes it can cause damage to the others. But sometimes we have to outweigh the risks and the benefits, and your doctor is really good and has been trained to do that. So we know, how to monitor your labs, and that's another reason why I tell folks, even if your sugars are controlled, your blood pressure is controlled, you still need to go to your doctor regularly, because we have things that we have to monitor, especially if you're on other medications. We have to monitor your kidney function, all right? Because we don't want to see that kidney function get worse. Men, if you have a creatinine of 2.5 or higher, then we have to stop the creatinine. We also know that certain CAT scan dyes can filter through the kidneys. It can cause, I'll tell you in 1 second, Trinae, a CAT scan dye can cause more damage to the kidneys as well. So before you get a CAT scan with dye, we have to check your kidney function. And if your kidney function is too high, then we can't give the CAT scan dye, and we'll have to do something different. So, Trinae, what is a creatinine of 2.8? 2.8, that is stage, I believe 2.8 would be stage 4. Stage 3, you're in between a 3 and a 4 kidney disease. So that means that we are really monitoring, and we're going to work really hard on improving your other medical conditions, like your your diabetes, your blood pressure. We want you to stay hydrated. Now, you know what? This actually brings me to my next topic of how do we prevent the chronic renal insufficiency, and how do we treat it? So basically, once the kidneys have been damaged, there's really not much we can do to fix it, all right? So we can't go in and repair the damage that's been done. So at that point, what we have to do is prevent any further damage, or any how fast the damage occurs. Now, we all know that as we go through life, our bodies will deteriorate some. So there's always going to be some form of damage, but we don't want it to be advanced or quickly damaging. So we want to slow down. For instance, if the kidney function is going down this fast, we want to slow it down so it's not going down as fast, all right? So we want to make sure that you're staying hydrated, that you're drinking enough water, that your blood sugars are under control, and we want those blood sugars to be optimal. And when I say optimal, I mean you want an A1C between 6 and 6.5, so it can be optimal. You want your blood pressures to be optimal. A normal blood pressure is 120/80, and we want to see that or below in people that have chronic renal insufficiency. There's also some medications that we can put you on to help your kidneys function a little bit better. These are things called ACE inhibitors and ARBs, or angiotensin retention blockers, ARBs, all right? Angiotensin renin blockers, ARBs. So we can put you on one of those to help improve the kidney function as well. Limiting your alcohol, because increased alcohol is going to cause more filtration through the kidneys, and more filtration means more possible damage. So limiting your alcohol, limiting your NSAIDs, limiting sodium, because sodium also filters through that kidney. Now, sodium molecule is not as large as that sugar molecule, but it is still a larger molecule that has to filter through. So when you have more sodium on board, your kidneys are doing more work to try and trap that sodium and urinate it out. And the more your kidney has to work, the tireder your kidney can get, okay? So, of course, we want you to exercise and eat a healthy diet. And you can get with your doctor, who can either go over it themselves or get you with a dietitian to give you how much fluid you should be drinking, because we want you to have enough fluid, but not too much fluid. I know it's kind of like how do I know how much or what's too much or what's too little? That's where you need to get with your doctor, and they need to make a personalized plan for you. And if they can't do that, then they can refer you to a dietitian who can tell you exactly how much sodium, how much protein, how much water, and how much electrolytes and things that you need to be taking in, all right? That's the other thing that we need to limit when you're having renal insufficiency, is how much protein you're taking, because protein, again, is one of those larger molecules that can come through, and when it filters, it can damage the kidneys, all right? So my last thing I want to talk about is what happens when the creatinine, does that depend on your weight? Jamel, let me know exactly what you're talking about. Does what depend on your weight? You're talking about the creatinine, what exactly are you talking about? Let me know, and I'll answer that question for you. Yes, Trinae, yes, you got to stop eating meat or limit the amount of meat that you're eating, because that's all that protein. And the more protein you have to filter, the more damage you can have to your kidneys. All right. So last thing is, if you are not, if your renal insufficiency, your chronic renal insufficiency, it worsens enough the amount of water you need to intake. Yes, that is based some on your weight and also on your other medical conditions. So, Jamil, what we often recommend for people that don't have kidney disease is that you drink half of your weight in ounces of water. So if you weigh 200 pounds, you need to be getting in 100 ounces of water minimum per day. All right. But if you have some renal insufficiency or some other health problems, then we can tell you sometimes we have to limit that to, 2 liters of water a day or to 2.5 liters of water. But that really is based on you. But yes, the amount of water you take is most times based on your weight, as long as you don't have other medical conditions. All right. So if your renal insufficiency worsens to the point where your kidneys are just too tired and they can't filter anymore, then all of that uremia is, all of that uric acid is building up in the blood, and you're getting sick, then we have to filter it for you. So how do we filter it for you? We can do what's called dialysis. Now, I have seen cases where the acute renal insufficiency, the acute renal failure is so bad that we have to do dialysis emergently, like right away. That's when people are in the hospital, they've been maybe down for a while, they've had muscle breakdown, the muscles have come down and shut the kidneys down, or they've gotten really sick, they've gotten really uremic, and we've got to filter that stuff out for you. So we can hook you up to the dialysis acutely. We can do that filter for you. So what is dialysis? Dialysis is essentially, it's a kidney or a filter outside of the body. So we put basically a tube in the artery to get the blood, and then it goes through this machine. The machine filters all the bad stuff out, all the uric acid and all the stuff that's not supposed to be there out. And then another tube goes in the other side, and the good blood goes back in. Now, dialysis, like I said, it can happen acutely or it can happen chronic. So if you're chronically got chronic renal insufficiency and your creatinine is very, very high, usually we're talking, this is stage 5 kidney disease or end-stage renal disease, we're talking about creatinines up in the above 4. And so when the creatinine gets that high, it's time to start talking about dialysis. And we can do a whole Facebook Live on dialysis in general by itself, but dialysis is essentially filtering the kidneys externally. So there are 2 different types of dialysis. There is what we call hemodialysis, which means it goes through the blood, and then there's peritoneal dialysis, which means it goes through your stomach. Hemodialysis typically occurs 3 days a week. So you're either on a Monday, Wednesday, Friday schedule, or you're on a Tuesday, Thursday, Saturday schedule. You go into the dialysis center, and usually that process can take anywhere between 4 and 6 hours. So it's kind of an all-day process, and they're basically filtering that blood for you. So I stress to my patients, especially when I'm starting to see some renal insufficiency, let's prevent this early so that we don't end up on dialysis. Dialysis takes a lot of your time, takes a lot of your effort, and people can feel pretty bad when they're going through dialysis, because on those days that it's still building up, the toxins are building up, you kind of feel kind of crappy because all of that toxin is still in your body. So we want to prevent you going on dialysis, okay? Peritoneal dialysis basically means they hook it up directly through your abdomen or through the peritoneum. That's through your stomach, and that can be done at home. That is a continuous process. It usually happens overnight, and you can hook up to the machine overnight, and that process can happen there. All right. So that is my talk on the kidneys. I know that was a lot of information, So we talked about what the kidney is. It's a filtration system. How does it work? It brings the blood, comes into the kidneys. It filters all the bad stuff out, and then the good blood, the clean blood, then goes back out. When it doesn't work anymore, what can happen? And so we went over that list of symptoms, and I'll just go over those real quick. You can have reduced urine output, fatigue, nausea, tiredness, poor sleep, poor appetite, swelling in the hands, feet, face, and fluid building up into the lungs, all right, which causes shortness of breath. We also talked about the difference between acute renal insufficiency when it happens right away, either because you're not getting enough fluid in, you've had damage to the kidney, or you've had a blockage from the bladder to the kidney. And then we talked about chronic renal insufficiency which is where you've had kidney damage over time and chronically your kidneys are getting worse. All right, and then if you've had chronic renal insufficiency for some time and the kidneys continue to get worse, then we have to do something where we have to filter it for you. Sorry about that, guys. And that's either through dialysis, whether that be hemodialysis or through peritoneal dialysis. All right, so one more time, how can you prevent kidney disease? Keep your sugars under control. I tell folks that all the time, and I'm sometimes amazed to see people with diabetes like totally out of control, and it has to get these sugars under control soon. It will affect the kidneys. So we want to keep our sugars under control. We want to keep our blood pressure under control. We want to drink enough water, and you can discuss with your doctor how much water you need to be drinking based off of your weight and based off of your other medical conditions. We want to, of course, exercise and eat a healthy diet. Things in the diet that we want to limit would be protein, because protein can damage the kidneys, sodium, because sodium can damage the kidneys. All right, sorry about that, guys. My signal's going in and out. So the last thing is limit your protein, limit your sodium, and limit the amount of NSAIDs or anti-inflammatories that you're taking. And those can be things like Motrin, Aleve, ibuprofen. So you want to limit those things, all right? So because my signal keeps going in and out, I'm going to go ahead and end this conversation. Listen, I'm going to be coming up with some information for you all. Please follow me on Facebook Live. Follow me on Facebook so that you can get the information about my new medical practice that I'm going to be launching. I want to help people, everyday people, to get their lives under control, get their health under control, so they can live better and have greater impact on those around them, right? So follow me on Facebook Live. Watch out, because soon, probably this week, we're going to be letting you know some information about how you can get more in contact with me for either to be my patient or to have one-on-one sessions. How much water should you drink? Well, Trinae, if you see Dr. Witherspoon, let her know. She can let you know exactly how much that is, all right? So, please, you all know who I am. I'm Dr. Nicole, your board-certified family medicine physician and licensed professional marriage and family therapist. I help people live their best lives by transforming their mind, body, and spirit, and help them understand their... All right, found another signal. All right, so let's try that one more time. I'm Dr. Nicole, your board-certified family physician and professional marriage and family therapist. I help people live their best lives by transforming their mind, body, and spirit so that they can have greater impact on those around them. Through my books, my concierge medical practice, my seminars, and my live streaming, I help people live their best lives. I help pastors, congregations, everyday people so that they can impact those around them, and so that they can understand their medical conditions in terms that they can understand, all right? So please follow me on Facebook, www.facebook.com/Dr. Nicole D.O. That's DRNICOLEDO. All right, how you can become one of my patients and how you can get more information about your chronic medical conditions in terms that you can understand. All right, guys, I'm gonna go because this signal is horrible in here, but that's okay. Have fun, be safe, drink your water, get your exercise, live a healthy life. When you know better, you do better. I'm Dr. Nicole. Talk to you soon. Bye-bye.